button. Okay, sounds good. Well, again, we're glad to have all of you. We wanted to take a moment and not only just say thank you for being our community partners, for taking part in these meetings. Janelle's done such a wonderful job in being able to lead these discussions monthly. And you all have brought so many resources and so much important information to the table. And we want to continue being able to do that, but we want to still meet your needs. We want to hear what's important to you. Before we do that, let's talk a little bit about the Share Network. I know, you all, for the most part, know who we are. You're familiar with our mission about being able to bring all the knowledge and resources to the south side of Chicago, bring it to all of you who can then go out and disperse it into your networks. And it's not just about the resources, but it's about the education that comes along with it. We really are focusing on that. For those of you that aren't aware, we started back in 2015. We are a grant funded program, and we are in our last year of our grant funding. Now, we are applying again and hoping to continue bringing those resources, throughout throughout the year. But we just wanted to at least share that information with you as well. Since 2015, our work, as I said, is all about our community. How do we educate and empower all of our community members and create that network? But also, there's two sides of that. We have to create a network, and that involves everyone from those that are all of you that are boots on the ground, our healthcare providers, and our community members. It takes all of us. It takes a village. So we've all come together, and that was one of our big goals. For those of you that aren't aware, we are a very small but mighty team. You've met Janelle, you've met myself, there's a few others, but we want to put a few faces to some names that you may have heard, and making sure that you know who you can contact as well. So just to kind of give you a sense, we've got our project director, Dr. Kate Thompson. She pops in here and she will give so much great information. She is a geriatrician, and she does see patients at the Southside Clinic as well. And then you have myself, and you have our wonderful Janelle. We have Jeff, our program development and evaluation manager, looking at all that data, looking at all those numbers, being able to help us understand the need, understand what's going on once we deliver some of these programs. Are these meeting the needs of everyone around? We've got Monica, our wonderful clinical nurse educator that's going out. You may have seen her provide some of the presentations out in the community. And then our newest member, Ashley, she's our new project coordinator. She's fantastic. She has been doing a great job in being able to support any programs that you're looking for, any presentations. And Ashley, I don't know if you're in here right now, but if you are, or Janelle, if you wouldn't mind throwing Ashley's email address into the chat. She is your go-to for she and Janelle, your go-to for any of the presentations you're looking for. Ashley would be one that she's going to help coordinate those. So when you see her email address, when you see her name, she is definitely part of the Share team. And then some other faces that you may have seen that have come out into the community: Dr. Stacy Levine, Dr. Lauren Gleason, Dr. Shelley Williams. They are essential to our team. They're the ones providing a lot of these resources. They're the ones going in and providing the presentations. So we are forever grateful for all of their knowledge as well. And now we would be amiss without introducing you to the newest team member, who I think is the cutest team member, Miss Janelle, and her sweet little handsome man, Mr. Mason. Janelle, you want to share?
Yes, Mason is the new highlight of the team. He is now 3 months. He'll be 4 months on the 2nd, on February 2nd. So that time has flown by. But as you see, he's a pretty calm and happy baby. He really is a joy to our family. He loves playing and talking and giggling and he likes us singing to him and all those great things. And I'm sure many of you are like, oh, how is he? How does he look? So I wanted to make sure that we show you guys him. So that's Mr. Mason Michael Bennett.
Already representing his University of Chicago gear. He's proud of all his mama's work, and rightfully so. You just want to squish those little cheeks. Oh my goodness, he's so cute. But again, we have to show off handsome little man that's the newest addition to our team. And thank you, Janelle, for sharing him with us, because he is precious, and we're just
Absolutely.
so happy for you.
Thank you.
Just a few more just important notes, just kind of talk a little bit about some of the projects and some of the work that we've done. For those of you that don't know, we do a lot of work going in and training, as I mentioned earlier, about training medical professionals. We've trained over 700 University of Chicago residents, and some of the different fellows as well, geriatric and palliative fellows. We've worked with Oak Street Health providers, over 1,000 providers there. We've published several different articles, and this is just a few that we've published. There's a few more that have come out recently, and we've presented multiple posters and different oral presentations to different aging conferences across the country, including one at the Kroc Center, the Alzheimer's Association Caregiver Conference as well. We've had our team there, American Society on Aging. So the Share Network is getting out there, getting the word out there. And that's where you see us in the community. We've had over 400 healthy aging presentation. We've reached over 7,000 different members, and we go through a variety of topics, all focusing on this important topic of these 4 M's: what matters, medication, mobility, and mindfulness, talking about all these different topics. It could be at health fairs, at some of the different expos, at conferences, block parties, festivals, the list goes on and on. And it's all because we have been able to work with all of your wonderful organizations, and we appreciate you being able to allow us into your homes and into your communities as well. And then again, just wanted to share a couple more things that are going on. We've got our dementia care group, support group that Janelle and Monica lead. We also have our Centering Our Values, which is the dementia care and decision making tool. It's an online tool anybody can go through. You can scan the QR code that's there, and I'll give it just a second, but you can go on the website, centeringourvalues.org. Check this out. The website and the booklet are fantastic. As a social worker, I'm telling you, this is such a great tool to be able to utilize and have in your back pockets, because of the ability to print out things, explore the resources, everything that you need. All right. And again, we thank you. We thank you for allowing us to come out and share all the good news. And then there we go. We have distributed over 28,000 to over 28,000 Chicagoans, then released our 4th edition of this book. The online version's been visited well over 100,000 times. We are so excited about this new edition, all the information. It keeps getting bigger and better, and that's because you guys keep giving us this feedback. And so that's where these community partner meetings are so important. I'm going to pass it on to Janelle here, and she's going to talk a little bit more about the community partner meetings and their purpose, and the importance of all of them.
Thank you, Renee. And so many of you all are not new at all to the community partner meetings. You've been with us for years now, and we thank you for that, especially once the pandemic came along and we switched to going solely virtual with the community partner meetings. Everyone has continued to come, and so we thank you all for allowing the community partner meetings to be what they are. It wouldn't be without you all. And so just want to highlight for those who are new or for those who just need a reminder, just the purpose and why we continue to keep these going and why we look forward to having you all each month. And so the community partner meetings really is a space for aging service providers such as you yourself, anyone that services older adults, to be able to come together, to be able to learn about resources in the community. And we do that by having the presenter who typically is presenting that first half of the meeting. But then also it's a hub and safe space for aging service providers to be able to just be able to have a safe space to vent, to pose questions, to share some of your experiences, things that you're facing, and then also network, share some of the resources you have, things that you want to learn about. And so we know that regardless of what hat you wear, no problem, what role you are in, whether that's a resident service coordinator, whether that is a community group that services older adults in some capacity, looking back at who we've had as presenters, such as the Sounds Good Choir, or we had Jim Sullivan speak for Paying for Alzheimer's. We had several of our different doctors and counselors from the University of Chicago speak on different mental health things, to alcohol and medication use. We learned from Terra Nova Films and how they are looking to reach the community through short films that they create. So whatever role you play, whatever hat you wear, and how you service older adults, we just want to make sure that you have a place to be refueled, you have a place you can continue to stay connected, and mostly a place you continue to stay resourced so that you can share those resources and serve your community best. So with that, we want to know what you need so we can continue to thrive and continue to serve you all well in the upcoming year. So we have a kind of like a routine of each year discussing what went on in the past, what did you like, what's something you want to highlight, and then what is it that you need now moving forward. So now's our time. We will just kind of facilitate some questions that'll prompt some thoughts from you all, and then we really want to just hear from everyone who's on today. So with that, our first discussion question is, one thing, may you name or think of one thing that your organization did really great in the past year. So 2023, I'm sorry for the typo. So in 2023, what is something that you would like to highlight from your organization? I know you all are all doing some really great stuff. So I see Regina Hampton has her hand raised. Regina, when you're ready, you can unmute and we'd love to hear from you.
Okay. Hi, Regina from Access. Welcome back, Janelle, and Happy New Year to everyone. Well, one thing that we did last year, which I thought was fun for me, we did focus groups, and we did about 5 of them, talking to our senior housing residents or senior programs, just to hear what they would like to see as far as services, what they didn't like. And it was kind of enlightening. Hopefully we will be able to implement those in some of our services, but that was fun. I was able to facilitate those and get them coordinated. So that was really fun activity that we did. And just also just making an impact, trying to get to as many senior locations on the west side that I was able to do just info sessions, just to share some of the benefits that we have at our organization. So I thought that was pretty good.
All right. So if I heard that correctly, you said you all did some focus groups. So you're able to really hear from the residents, like what they were enjoying and some new things that they needed. As well as you were able to visit some new sites.
Yes.
All right. Well, I'm glad. And I'm glad that you feel good about that. And you can kind of do like we're doing, use that as you move forward into 2024.
Yes, and I was able to use some of your books to drop off to some of the sites to kind of help get your foot in the door. Say, oh, this is a wonderful resource. Even on the west side, I said some of them are citywide, so feel free to use them. So thank you.
Awesome.
Absolutely. That's what we like to hear. I
There's
see
one
in
in
the
the
chat
chat. Yep.
that
ahead.
Nicole Righty. Hi, Nicole. She said that she created new support groups / programming. That's always great.
Woohoo.
We always need more and more support groups.
Yes.
If you'd like to speak to that, Nicole, just let us know. If not, we appreciate you posting that in the chat for us. And I believe I saw Jim, your hand raised. Hi, Jim.
Hi, how are you?
I'm good.
Thank you for sharing your pictures of your new baby.
Oh, no
Good way to start a
problem.
meeting. With Pain for Alzheimer's, our first full year of operations last year. And the best thing I think we did was just reaching out, and I've done dozens of seminars and webinars to local community groups at libraries, at churches, talking about the financial burden that Alzheimer's disease imposes on families, especially those in low income and middle income families. And working with several families, we've helped them get a better focus on the disease, its progression, and what the costs are, and what they need to do to better plan their household budget around the disease. And I think that has been just a wonderful thing that we're blessed to be able to do for families who are, first of all, burdened with the anxiety of the disease. And then, of course, shortly after that, they're worried about paying the cost of the disease and still being able to find the right care to meet the needs of their loved ones. So that's where I think we've had a good year, and we continue to do that and look forward to the coming year.
Congratulations
Awesome.
on that. That's
Yeah.
fantastic.
And we look forward to hearing on more about like how that's going with being able to support families, and let us know if there's anything we can do to support. I see we
I
have in the chat.
share.
Okay,
Oh.
Phyllis, go ahead. And then, well, can I share what we just had come up?
Sure,
in the
go
chat?
ahead.
All right. So Mari Mack of U Chicago has been working on grants to help fund studies to help older adults with dental issues, also substance use disorder. Yeah, those are two high key things that older adults need support with. So, Mari, is that a grant that went into effect last year, or were you working on that and now the grant will be implemented this year?
I'm waiting to get it approved.
Okay. Well, that's the biggest
So-
piece of putting it all together.
Fingers
have
crossed,
with
yeah.
you. Yes. Thank you so much for sharing that. And like with all other good news, please keep us posted. Let us know how that goes. All right, Phyllis.
Yeah, I just wanted to share myself and a community partner, Janie Urbanik from South Loop Village, has given dozens of dementia-friendly presentations across the South Side, sharing information on healthy aging, dementia, Alzheimer's disease, and presenting research opportunities to the community. And so presentations and that work is something that both of us are really proud of.
And we are proud
Awesome.
of you all too. Enjoy spreading the word
Thank
about
you.
those memory cafes. So thank you.
Yes, Lucas, I'm glad you jumped in. Chicago Hyde Park Village launched a memory cafe. The amount of memory cafes coming back is just amazing. So I'm glad that you brought that up. The one in collaboration with Akarama, 3 memory cafes on the South Side. That is so incredible. That is definitely something to share and highlight over and over again. Thank you for putting that in there. Absolutely. So we've got the one here with Hyde Park Village, and I know Monica also started the one at the Croc Center too. So those are the two newest ones, but that makes the three right now that we've got going. And remind me of the third location. It's skipping my mind at the moment.
It's at Second Presbyterian
Loop.
Church in the South Loop for now. Yeah, right on 18th and Cullerton.
Okay. There we go. Loop Village. Awesome. Congratulations to all those involved. That's a lot of work, and that's fantastic.
The South Loop actually was the first memory cafe in our area. And they've been
Oh.
kind of a model and an inspiration for the rest of us.
Yes.
Yeah, and there's
So
also a
exciting.
virtual
know
one.
that.
Yeah, and there's also a virtual one as well,
Right.
hosted by Northwestern in the South Loop Village. So there's lots of memory cafes for everyone now.
Yay.
Yes.
Thank
Much
you.
And I
Yeah.
see, Lucas, you post for us in the chat a flyer that has all three memory cafes combined. So thank you. We will make sure to share that with the follow-up email. So thank you so much for that, Lucas. That makes a lot of sense. Just put it all in one place and disperse.
It's true.
And this is great. I'm taking a look at it now. This is really great. All righty. Anyone else want to share or highlight some great things that happened in 2023 with your organization?
Got Body Part Senior Fit Foundation. Dr.
All right.
Cecilia
I see
Brown.
Dr. Cecilia, your hand is raised. Welcome.
Hi, I was just listening to all the good news. Happy New Year to everybody. And I'm in Chicago. I think a lot of us are in Chicago from the cold weather. So excuse me, but I think I'm dressed appropriately. So, I just wanted to, first of all, say thank you for this wonderful platform. Wanted to share, which I did mention, we changed our name. It's kind of long, so we have BSF, but it was always Body Parts Fitness, but now it's Body Parts Senior Fitness Foundation. We've already had the foundation for a while, but now that I've learned that I am a older ager person now, so it's serving only seniors, if you will. So it's Body Parts Senior Fitness Foundation. It is non-for-profit. It was in memory of my mother-in-law as a caregiver back in the day, but as time has gotten by and older, my husband and I and the team is focusing on seniors. And I just put in the chat, our longevity is with the University of Chicago Urban Health Initiative. And my colleague, Ms. Johnson, she's now added YouTube because some of the seniors, they weren't really connected with Facebook for viewing the online classes anytime. I mean, it's in the morning from 8:15 to 9, but some of the seniors don't get up as early. And so now we have the videos on YouTube that you can look at anytime, opposed to just going to Facebook. So I just put that in there. But to answer your question, what we did for 2023, I got a chance to go to, which I think she's on here, Miss Reed, the resident director of Paul G. Stewart. She had a health fair. So, she had tables and vendors. So we got a chance to actually revisit, because in 1992, I believe, that was our first site that we went on site to come up with the idea of having exercise at senior buildings. We just happened to be at the right place in the right time at Willa Rawls, where we were in their cafeteria space for doing exercise. And the next thing I know, we were connected with Wheels on Meals and Department on Aging. So it was a good opportunity to propel us. But before then, we walked to Paul G. Stewart, and they were so kind to let us have our first senior class there in 91. So we visited her, and they're still going. I mean, some of the seniors have passed away. That's one of the things that we have to endure in our program. But it was a pleasure to meet Ms. Reed and her staff, her wonderful staff, and the event was well attended. Also, we ended up partnering with two new organizations, GAGDC, which is Auburn Gresham, it's a lot to say, Auburn Gresham, Greater Auburn Gresham Development Corp. Excuse me. So we partner with them I'll maybe put it in later, but the end of the year, I mean, the end of this month, they're having a free health fair for seniors. So I need to try to share their information. And then we actually partnered with Dr. Conrad World Track and Field Center. And that's because some of the seniors walk. And although we do walking at the University of Chicago / Museum of Science and Industry, that's in Hyde Park. So we needed to branch out further south. So now we're in the hundreds, and I think it's, let me think, West Pullman. So we are doing walking there, and with GAGDC, we'll be doing some programs. We met them by having 2 pilot programs, one at each site on a Tuesday and Thursday. It was for 2 hours. We did bingo, we did fit and food and all of that, but we're paring down because we did apply for a grant. I think it was called the Starting Block Grant, and we're still waiting to find out in round 2 of fundings, will we get some funding? Because as a non-for-profit, you have to diversify your streams of income. So not only writing grants, doing fundraising activities, we're learning and still trying to piece together how we can diversify our streams of income. And that also means building up our board. Yeah, I'm trying to do some education classes. I thought I was done with school, but you're never done with school. So I just want to share with that. We did.
So you're going now?
Pardon me?
No, I think, yeah,
Okay.
I think we got it. We're good.
Oh, okay. I'll hurry up. And then I wanted to say hello to Mr. Anyway, I'm still trying to diversify income and going to school for these different classes. But I also want to say hello to a Mr. Wright, because I saw that he was at St. Brendan. And that was one of our sites years ago. We were at St. Brendan. I think St. Brendan had 4 buildings or 2 buildings or something together, if it's the right one. Okay, yeah, 2. St. Thomas, maybe? St. Thomas and St. Brendan? I don't know. But anyway, it just feels good to
It's
know
Hayes
that.
Manor and St. Brendan.
Okay, yes.
Hayes
Okay.
Manor and St. Brendan. We're
Okay,
together.
well, we were at St. Brendan, thank you, years ago. So I don't know, you don't know me, but I know the building, and I'm sure the residents have changed. I just wanted to say hi, and we're still hanging in there. They say between the age of 40 and 60, you're considered middle age. So I'm middle age right now, and they say after every 10 years, you lose 30% of your muscle mass. So if you don't have any other program to go to, make sure you include strength, make sure you stretch, and most importantly, make sure that you don't overdo it. It's a new year, so I just want to leave that with you. I teach in my class as a way of a motto. It's not about perfection, it's about progress. So.
Yes, thank you so much, Dr. Brantley,
Sorry
for
about
sharing
it, but it's
your
in-
knowledge, one, but then also thank you for the passion that you and your husband have and your team, and making sure that not only are our older adults, but all throughout the community, you know, the older adults are staying active, staying healthy. And so we will keep our ears open on anyone needing that type of programming and make sure to send them your way and see how we can just keep those partnerships building for you.
Thank you. I'll try to include a flyer if I can. I'm a little rusty at some of this, but I appreciate you. Thank you.
Absolutely. So now let's look forward into 2024 as we at Share Network plan and think about ways to support you all. We cannot do that without first hearing from you all. We really want to know, what are you looking forward to in terms of what do you want to learn? What are new ways you and your team hope to grow, and what are ways that we can support with that, whether that's individually or even as a collective in your organization? I know with it being a new year, we also have resolutions or we have room for improvements, things of goals that are set as a team or individually. So thinking about all of those different factors, what you may have spoken to your team about, or what you may be thinking in, you know, on your own, what can we do? How can we help? And what are you looking forward to? So I know there was a mouthpiece, so I'll stick to what it says here. What is one thing you are looking forward to learning, or ways you are looking to grow? And I saw your hand raised, Mr. Wright, so go ahead.
Well, I wanted to say, first of all, Happy New Year. And I wanted to say a key piece that we've used here at the building is the guide.
Yay!
And I have to tell you, we put this out at in both buildings, Hayes Manor and St. Brendan, and not only do the seniors get them, but the home care workers that come in the building. Many times they'll come up to me, Mr. Wright, can I have one of those? And I'll say, yes, it's free 99 today. Free 99, yes. You can take one, share it. And so again, other people who come into the building also ask, is this something I can have? Absolutely. And so it is just a great resource that we've used. And I also want to just thank you for all the topics during the year. Many times I wasn't able to attend meetings, but just going back and seeing the notes, again, that helps us with our newsletters that we put out monthly to give community information to residents. So very helpful. So please keep doing what you're doing because it's very effective and very helpful. Thank you.
Oh, thank you so much,
Thank
Mr. Wright.
you.
That really does help us to feel good, which we already feel great about what we're doing, but to know like people are coming and using those and asking, and you're like, yeah, you can have them. And guess what? I actually read those follow-up emails and I need those because I put them in my newsletters. That's helpful. Like, thank you so much. And we will keep it going. We will continue doing that. Susan, hi. I
Hi,
see my
welcome
hand
back.
raised.
So
Thank
good to
you.
see you. I just keep up what you're doing. I think these meetings are so very important for us to meet others who are doing work on the South Side, hear about what you're doing, sharing ideas. So I don't have anything new for you to do. I want you to keep up what you're doing.
Okay. Well, thank you. Do you have anything new that you're doing that we can help with?
Well, I think Lucas has already talked about our new memory cafe. We do have a monthly a lunch gathering coming up on Wednesday, which is sort of in anticipation of the Lunar New Year. And it's at Augustana and everyone's invited. It starts at about, we've expanded the time. The program will actually start at 11:30. People can come earlier than that and it'll go to 1. But it's mostly showing New Year customs for the Lunar New Year. So, Lucas, are you going to add to that?
Yeah, sure, I can add. Hi, everybody. Thanks
Hello.
for sharing, Susan. Yeah, well, not much to add about that event on Wednesday, but I guess one thing I'm looking ahead to this year, if we can hopefully roll it out this year, is well, we're trying to build part of the whole dementia-friendly Hyde Park initiative. We're hoping to create some sort of a way so that local businesses can certify as dementia friendly, as just a great way to promote to the community that it's a dementia friendly space. You'll be treated with dignity if you come in here, and so that's something we've been slowly inching towards, but definitely hoping to roll that out. And that's also the kind of thing where getting the whole network together to help us promote this and roll it out could be really helpful. Thanks.
That's exciting. Very exciting.
Thank you so much, Susan and Lucas. I saw that Stefana had her hand raised and then Milton. And I'm sorry if I've forgotten anyone else. And I do see we had in the chat as well from Nicole. So we'll go in that order. And I'm sorry if I'm out of order, but we'll do Stefana, Milton, then Nicole, and then whomever else. I'll look for hands raised. All right, Stefana.
Did we lose her? Oh no. We can't hear you, Stefana. I wonder if she's having a computer glitch at the moment.
Yeah. Well, while we wait, and I'll send a message to her through the chat. And during that time, as we wait, then Milton, did you want to go ahead, Mr. Milton?
Yeah, one thing I wanted to ask to the group for something we're thinking about for 2024. We thought about it right before the pandemic, but we'd like to have more programming for intergenerational groups to involve seniors with youth. I just feel there's such a huge disconnect, especially in many neighborhoods where seniors are not connected to younger folks, and sometimes it's because their grandchildren don't live in the city, or just a lot of kids don't have interactions with older adults, with seniors. And I think it's sad because seniors have a lot of wisdom and experience to share with the youth. And then I also think that when the youth is in the room, they bring, a little life in the room, and the seniors kind of pep up. And so just to kind of connect them, we're just thinking about just having more programming to kind of connect those two segments together, because it benefits both.
I absolutely agree. I'm sure we all here can agree with that. In fact, Phyllis just typed in the chat, love that idea. So that is something that I will definitely take note of, and we can look at, are there some intergenerational programming or ways that we can at least just get the discussion going and seeing how we can get that started in the community. Can't make any promises, but it's worth us knowing we can put it on the radar. Okay, I see that we have in the chat, Nicole Righty shared that they are looking for ways to increase diversity from different cultures in their programs, along with learning ways to promote programs to different cultural groups. So again, just diversity, so intergenerational diversity, or diversity of different cultures. Did you want to elaborate a little bit on that, Nicole? And I like that idea. I believe I understand it, but just want to make sure I'm getting everything correctly. Okay.
It looks like Stefana is also back as well.
Okay.
Just so you know. And Nicole said, diversity of different cultures. Her mic doesn't work. No worries at all. We appreciate you still contributing. And that's absolutely, I think the more diversity we can have, as Janelle said, the better. I mean, we need to be able to promote all different types of programs, and be mindful that not everybody can fit. You can't fit a square peg into a round hole. So we have to be mindful and be supportive. So this is wonderful ideas. Absolutely wonderful. All right. And Stefana, did you want to add? I know you, there we go. You're looking forward to expanding your creative arts programming. Woohoo! We've hosted a few successful creative circle groups, and residents love participating in creative art programming. That was fantastic and a great experience. Just to kind of share with everyone, with the Foundation of Art and Healing, they have, it's now called Project Unlonely, or the creativity circles. And some of our students have been, we're going into some of the different senior housing buildings and being able to provide programming. And it was a wonderful opportunity for not only for the residents who, it's all about being able to socialize, to utilize the arts to help with that socialization, but then also have students learn, we're talking about that intergenerational work, having our students learn more about, the community around them and the community they're going to be serving. These were social work students. So it's a really great opportunity. So yes, that was really exciting. James, continue to seek referrals of families struggling with the cost of Alzheimer's and other chronic and terminal diseases. Our services are free of charge into low-income families. Yes, the more we can spread out that word, fantastic, because again, I've seen this as a social worker, and I'm sure many of you out there have also seen how difficult it can be, paying for care, paying for, basic resources and supporting our, loved ones and individuals. So having these types of services that are free of charge are fantastic. Thank you for having that for the community as well. Regina, you'd like to be SHIP certified and taking classes on aging to share in my older adult presentations. That is wonderful, and that is something to definitely look forward to. Stay tuned as we continue to develop our programming too. That's a big thing that we want to make sure we're sharing, as well as being able to get all of our direct service care providers that education. So stay tuned on that one. I think you're going to be pleasantly surprised too. Phyllis, I saw your hand raised, but I see in the chat. Do you want to elaborate, or do you
Yeah, I can.
want me to read?
Yeah, I can talk. Yeah, so the new Healthy Aging and Alzheimer's Research Care Center at the University of Chicago is really looking forward to building partnerships in our new home within the University of Chicago and across the South Side. And a goal that I have this year is to really build partnerships and programming to bring our older adults over 80 together to learn about healthy aging and just to connect with each other, because we find that older adults in that age group who are healthy and active find it hard to find other people like them. So as much as we are looking to build networks for people who are over 80 and going strong.
It's fantastic. Super agers, it's wonderful. Love it. Love the term. Well, this is a wonderful, and there's so many good things coming about. So the more that you have, the more that things are popping up. Everyone, please continue to share. That's the big part of this, is we want to continue sharing as the future gets brighter and as it continues loading down the pathway for all of us. So we appreciate you being there and sending emails. As we send our updates, we send out all of your newsletters. So thank you. Yep, and Dr. Brantley, you agree. Body Part Senior Fitness included youth to exercise. You were talking about with Mr. Wright's conversation, but intergenerational activities. Older people often offer resources that children need. Yep, so much good information there, absolutely. And our next conversation, Janelle.
All righty, so we've heard some things that you all are looking forward to, but we want to dive a little bit deeper into knowing, are there any topics of interest or a community organization that you would like to present? So if there's a certain topic that you would either yourself like to present or you would like us to find a presenter on, we are all ears for that. Okay, I see in the chat, we have Dr. Brantley post a flyer. I can't quite see the flyer in the chat, waiting on it to open. But Dr. Brantley, did you want to share more about that? Is that, I'm sorry, I can't really see the flyer, so I don't know if it's.
That was the one that I had mentioned with our new partnership with Greater Auburn Gresham Development Corporation. They're having a free senior health and wellness community event on Wednesday, January 31st. So I just wanted to let everyone know where it's at and what's going on, and feel free to invite seniors to participate. With respects to a topic I've presented for the University of Chicago Urban Health Initiative, I'm sure pretty much people have heard about your SMART goals. So I've done that, and if that is a particular of interest, maybe I could share that information. It's kind of lengthy because it does get into how the practical part of it works, and I could probably cut that part out, but just keep it short and tight to what the acronym means and how you can apply it, not just to exercise, but to any component in your life, especially regarding the wellness wheel, which is about 8 dimensions of things that you can work on. So that's I can send it to you in an email if you want the flyer, if it's not visible here.
Okay.
I have it downloaded, and we'll make sure to send it out to the community with our recap emails too.
All right, thank you.
Thank you for that. I did see Stefana posted she would like to have more presentations from organizations that are utilizing arts and wellness. So we can be on the lookout for that.
Yes, Sonia, the conversation that we had in December, fantastic presentation. Thanks to Tessa from our neurology department. We were really thankful that she came in, and she, that was a big part, and that's partly why we also have this type of meeting too. Is we want to hear what's important. And the last share meeting, so many conversations about challenging behaviors. What are the big topics that you have? And if those are things that you're looking for, feel free to reach out to us, send those emails out and say, hey, do you have a community partner that can come and speak on this? I know there was a request once that was just talking about transportation, and we brought in RTA. So we'd love to be able to connect you with what's important to you. So please feel free to share those types of things with us.
I see Regina posted in the chat on topics on legal resources, estate issues, options to transfer property, avoid scams. Yes, we all should kind of have some knowledge of that. And mainly, as we know, that's a part of end-of-life care, just making sure we have things in place. Also, fall prevention and a presentation from Memory Cafe. Can you explain that part a little more, Regina? The Memory Cafe part?
Yeah, just if maybe someone who has one of those can just share what they do and, just more details and how it benefits the participants, just something like that. Because I haven't been to one before. I'm going to have to go to one of them.
Oh, that's a good thing to think about. I never thought of it in that lens, and just we do know that they have them, but yeah, our participants who join us each month. So Phyllis, Lucas, Janie, you guys maybe having some time to highlight what you're doing and how it's growing, the effects it's having on the participants, or I should say impact it's having on participants. I would love that. That's a great idea.
I'm sorry, what area are you in, Regina?
I live on the south side. My area is all over. So south side, west side, north side, all of that. So I'm pretty much community engagements. I float around a lot, but most of my engagement seems to have been last year, the west side and the south side.
Because memory cafes are something, that we really would like to spread to other communities. And we've been talking about that. We don't have anything up and running yet, but it's a community-based thing, really. It works best, if it's, specific to a particular community, but the more the better. We need them all over Chicago. And
that'd be great.
That's something we can keep talking about, seeing maybe who would like some support with beginning a new one. I'm not sure the capacity that's available to help someone begin one, to start one, in terms of those who have already started theirs, but it'll be good to just hear how it came about and tips even that you have for someone beginning their own memory cafe. I think I'm starting already. My wheels are turning, putting together that that meeting already. But thank you.
I didn't do it. I don't know. I don't know the specifics, but apparently there is a website. If you want to, first of all, be an age-friendly community, you can become an age-friendly community, and that's one step toward maybe developing a memory cafe.
There's quite a few websites, and I'm glad you mentioned that, Susan, that Janelle and I can include in the email that goes out about all the different memory cafes in the state of Illinois. If I'm not mistaken, they have a whole website listing all of those. And then there's the all of the dementia-friendly communities. I think there's like 31 of them across the state. Am I right? Or maybe even more.
I meant dementia-friendly, not age-friendly, but
yeah, no. I knew exactly what you were talking about. Look at Lucas, you are on top of it. Thank you. There's a memory cafe directory, and then there's all the dementia friendly. Just because I'm sharing screen right now, we can also put those all in the email too for everyone as well. But they're great resources. They do talk about, you know, how some of the memory cafes were created, you know, and then there's also the monthly meetings or the quarterly meetings that they have that talk about, you know, come together, bringing together individuals who are interested in becoming dementia friendly cities and things. So we can share that. Darby Moorhart and Phyllis, do you remember who?
Susan Frick from Rush.
Thank you. Yes, yes. And we just had one recently too, so it's nice to be able to be part of that group. So highly encourage if you're interested to be part of it. So we'll share that for everyone.
So I'm looking at
Janelle,
the time. We're
yeah.
like 5 minutes to the hour, and I do want to just highlight a few other things that were posted in the chat. I saw Stefana mention behavioral health providers to support older adults. Phyllis, you would like to know about, you like to hear from people and organizations doing innovative programming for older adults. So those are things that we are all here together. We hear this, we see this. If you know of anything, send it our way. If you happen yourselves to down the line, like, oh, I remember someone said something about that, please send it our way and we will do our best to have them come and present. We're going to try our best to compile all these resources and have them to you all, but we are a network, so it takes all of us. So please support by sharing any information you have. In the follow-up email, I will put this all in that, like condense these notes, and that way, that's another way to kind of jog our memories to be able to remember things that we can share and just what we discussed today. But lastly, are there any resources that you need for yourself or older adults that haven't already been stated, been shared? Okay, Stefana, I see you said we need more, absolutely, more veteran support resources. Thank you. Okay. So with that, we can go ahead and close the meeting out with another thank you. We want to say thank you to all of you. What we try to do here is think of every community partner that we've worked with throughout our time and have you visually here. So I hope you see yourself listed here, from Good Shepherd Tower to South Loop to Alzheimer's Association, Kroc Center, Off the Pews, Dementia Friends Illinois or Dementia Friendly Illinois, Mather, Paul G. Stewart, Northwestern Mazzulam Center. I hope I'm saying that right. We just want to thank all of you. I'm sorry, because of time, I can't literally go through every single one, but everyone who is here right now today, everyone who has been here, we thank you, we thank you, we thank you. We look forward to you. We look forward to just creating more great conversations, continuing dialogue as how we can support one another and support older adults. So with that, we will continue to meet every second Monday of every month at 2 p.m. So just remember, second Monday, 2 p.m. Same link, same time, same place. I will have that reminder emails coming out to you, as well as we will have the follow-up email coming to you as well. But in the meantime, if you have any resources to share, anything you just want to let us know, questions, to ask, you can always email myself or Renee or Ashley Mesnick, who is our new project coordinator. And all of our emails will be in that follow-up email as well. So with that, Happy New Year again. I'm glad to be back. Thank you all for the great welcome. And we look forward to a really great year with you all.